Completing a medication pass. Your patient, Donna Colby, needs digoxin, furosemide, lorazepam, and warfarin sodium. Select digoxin and furosemide for Donna Colby. Scroll down and select the lorazepam and warfarin. The medication queue on the right side of the screen shows all the medications selected for removal. You can also tap Review List. From the Review screen, you can delete a medication from the list or view details. You can tap Done to return to the previous view or tap Begin to start removing medications. You are ready to start removing medications, so tap Begin. Drawer 3 opens and the pocket unlocks. A Count Required dialog box appears if you must count the medications in the pocket before removal. Unlike previous versions of AcuDose RX, you must count the medications in the pocket before removing them. There are 8 lorazepam in the pocket. Enter 8 in the beginning count box and press the green OK button. Confirm the quantity and then remove the medication from the pocket. Note that you do not have to press OK to proceed. You may close the drawer when you see the prompt, Close drawer when finished. Drawer 4 opens for the next medication order. As you remove each medication, the medication queue places a check mark next to the completed removal and highlights the next medication to be removed. Remove the digoxin from the pocket. You are prompted to press Next after taking medication, since there are additional orders to be removed from this drawer. Another nurse needs a stat medication, so you want to let them use the AcuDose RX cabinet. Tapping Save and Quit will save any medications not yet removed. You will be able to finish removing the remaining medications after the other nurse is finished. You did not remove the warfarin sodium from the pocket, so tap Did Not Remove. Your selections are saved for 3 hours. Close the drawer. If you have a label printer, you have the option of printing a patient label, a receipt, or a medication or IV label. Tap Patient Label to print a label for your patient. The label includes patient ID, room, and date of birth. Tap Receipt to print a receipt of the medications that you removed. The cabinet can also be set to automatically print receipts. Tap Medication or IV. Tap Medication to print a medication label for a medication. Or tap IV to print a label for your patient. Tap Done. When you are done printing labels, you can select Go to Patient List or Log Out. For this example, tap Log Out. After the other nurse finishes removing her stat medication, you can return to the AcuDose RX cabinet, log in, and finish removing the remaining medications for your patient. Your patient has a note icon to remind you that you have a saved medication list. To continue with the MedPass, tap Select Items. The medication queue shows the remaining orders to be removed. You can also add additional medication orders. Now, tap Begin. Drawer 4 opens. Remove the medication quantity shown from the pocket. You are prompted to press Next after taking medication. Tap Next. Remove the medication quantity shown from the pocket. The quantity is grayed out, indicating that the quantity is enforced. You are prompted to close the drawer when finished. You have completed a MedPass using AcuDose RX.